Welcome, everybody. My name is Ashley Hortis. I am the Public Education Coordinator here at the Alzheimer Society of Thunder Bay. Before I begin, I'd like to make my land acknowledgement. I'd like to acknowledge that the services offered by our organization are in the traditional territory of First Nations, signatory to the Robinson Superior Treaty of 1850. Today, we are grateful to have the opportunity to work together in this community and on this territory. So today I'm going to discuss a little bit about what is dementia, about the Alzheimer's Society of Thunder Bay. So why is it important to learn about dementia? Dementia is on the rise. There are more than 500,000 people living with dementia currently in Canada. Right now, 912,000 Canadians predicted to be living with dementia by 2030. 28,000 Canadians are under the age of 65. They are living with young onset dementia. And 46% of Canadians admit that they would feel ashamed or embarrassed if they had dementia. And the reason I put that last statistic in there is just because part of our mission at the Alzheimer's Society is to eliminate stigma, try to reduce the stigma surrounding dementia as much as possible, because I do know that there is a stigma around dementia that oftentimes when somebody informs somebody or you find out somebody's living with dementia, our minds kind of go to the negative, right? They go to the negative of this person is no longer capable. It goes to the negative of this person cannot live a fulfilled life anymore. But at the Alzheimer's Society, we like to encourage that that's not true and try to break that stigma. Honestly, when you meet somebody or come across somebody on the street, they most likely either have somebody in their life living with dementia or know of somebody living with dementia in their lives, especially here in Thunder Bay. The prevalence is very, very, very high. So a little bit about what dementia is. Dementia is an umbrella term for a set of symptoms and changes to the brain that are caused by different diseases. So some dementia-related diseases that you might find familiar are Alzheimer's disease, vascular dementia, Lewy body dementia, and frontal temporal dementia. Now, these are also the four most common types of dementia-related diseases. All these diseases cause changes in the brain, and they all cause symptoms of dementia. With Alzheimer's disease, it's pretty well known to our society, and with Alzheimer's disease, it's currently affecting 60 to 80% of our population with the diagnosis of dementia. And with Alzheimer's disease, you'll notice things like memory loss first, some symptoms of memory loss to begin with, because the dementia is causing damage in the hippocampus of our brain. So that is what's going to be affected first is our memories, because our memories are held in the hippocampus. Secondly is vascular dementia, which is affecting about 20% of our population with a diagnosis. With vascular dementia, it's essentially little strokes to the brain. And so wherever those little strokes are occurring in the brain is wherever those symptoms are going to be seen first. So if those little strokes are occurring in the part of the brain where we have our physical abilities, where we're able to walk, once that's affected by a mini stroke caused by vascular dementia, then you're going to see those symptoms. The third most common type of dementia is Lewy body dementia. And so this is affecting about 5 to 15% of our population. With this type of dementia, it is often misdiagnosed for Parkinson's disease because it's showing very similar symptoms as Parkinson's disease in the physical abilities, as well as some auditory and visual hallucinations. And thirdly is another little subcategory for dementia-related diseases called frontal temporal dementia. And with this one, it is affecting primarily the damage in the brain, the changes in the brain that are causing these dementia symptoms are happening in the frontal lobes of our brain. So when you go to a doctor, or let's just say you have a concern for dementia, or you're seeing some changes in somebody's brain, you're noticing some changes in somebody's personality, the way they're acting, before the doctor looks at dementia, they're going to rule out treatable conditions first. So what is happening with these treatable conditions is that they are mimicking symptoms of dementia. These are called what we like to call reversible dementias. Some side effects of depression mimic those in dementia. Same thing with medication side effects, vision or hearing impairment, nutritional deficiencies, delirium, metabolic disorders, and sleep disorders. So all of these are mimicking symptoms of dementia, are presenting symptoms of dementia, but they are reversible. A true dementia is not reversible. These can be treated with medication, taking your medications properly. They can be treated with having proper hearing aids or glasses, getting your vitamins and nutrition in check. Delirium. So delirium is often caused by urinary tract infections is a common cause by it, but is often caused by infections, and it causes a delirious state that is very similar to dementia and is very often misdiagnosed for dementia. The difference is with delirium, it's the onset of it is a lot faster and it's very rapid and rapidly changing, whereas dementia, the progression's a bit slower. Metabolic disorders and sleep disorders. Sleep is a huge thing that people don't think about. Sleep can make us have all sorts of symptoms that could be seen as dementia, but is not true dementia. So like I talked about, those are not true dementia. Those are reversible dementias. Now I'm going to talk about some categories of what a true dementia is. So all true dementias are progressive. The symptoms will increase over time. No matter what the diagnosis is, no matter what age the diagnosis is made, no matter how fast or how slow things are progressing, no matter if somebody plateaus, if they have a diagnosis, an official diagnosis of dementia, the symptoms will always increase over time, no matter how fast and no matter how slow. All true dementias are degenerative. The brain cells die over time, and this cannot be cured. It's irreversible. So when I say true dementias, I'm talking Alzheimer's disease, Lewy body dementia, vascular dementia. These are all irreversible. The damage cannot be repaired. Sorry, this picture might look a little gross, so I'm just going to talk about it really quick. On the left is the picture of a healthy brain, and on the right is the picture of a brain, somebody who has been diagnosed with an advanced Alzheimer's disease, so a dementia of Alzheimer's disease, and they passed away when it was quite advanced. And so my point in showing the slide of the two brains, as much as it might be a little gruesome to see the real pictures, is that dementia causes physical damage to the brain. As you can see, the brain is warped on the right. It's warped, it's shrunk. There might be some plaques and some tangles in there. A lot of people will mistake dementia for just a mental illness, but it's not. It is a true disease that causes physical damage to the brain. Just the same as if somebody broke their arm and was having pain in their arm, that they couldn't move their arm and had to have a cast. The same thing if somebody was diagnosed with any sort of visible disease that we could see. With dementia, we can't see. We only see the symptoms, right? We cannot look into somebody's brain right now when we're looking at them and see the damage that's done to their brain. So when I talk about damage to the brain, this is what I mean. It causes physical damage to the brain. It's a physical disease. We only see the symptoms that are presented. So some risk factors for dementia. With dementia, there is tons and tons and tons of research going into it right now. We don't have definite answers on many things. These are things, when we talk about risk factors and we give you recommendations, these are all things based off of current research, but there is so much more research that can be done. We don't have the definite answer of this causes dementia. We can't say that, and we don't have that information. These are all things that we know are risk factors for dementia. I'm not saying that because you meet all these categories, you are going to get dementia. I can't tell you that, I've seen people who have all these categories and don't get a diagnosis of dementia down the line. So it's hard to say, but these are some of the risk factors that make you have a higher chance of dementia. So the number one being age. The older you get, the higher you are on that risk factor. Family genes and history. A lot of people think that family genes and history make up a greater chance of you getting it or developing dementia. But in all honesty, what we do know is that family history and genes only makes up about 5% of the chance of you getting dementia or a dementia-related disease. Brain injury causes damage to the brain, which increases the chance of causing more damage with that dementia and increases likelihood of that. So diabetes and cardiovascular disease, also a higher risk for developing dementia, unhealthy lifestyle choices, and history of episodes of clinical depression and stress. So a good rule of thumb that I like to use is what's good for your heart is good for your brain, and what's good for your body is also good for your brain. So with diabetes and cardiovascular disease, those are inflammatory diseases, and anything with inflammatory diseases can make that risk factor higher. These are some key factors that we've had research done of and that we know reduce your risk. Some people will do all these things and they still develop dementia, or they still, down the line have a diagnosis of dementia. We can't say the definite answer, but these are things that we can recommend that help reduce your risk, and that there is research showing that. Challenging your brain, doing crossword puzzles, word games. I know those seem silly, but they're very commonly overlooked, but they do help in reducing your risk of dementia. They do. We work out our bodies, we stay physically active, we work out our bodies, but it's also just important to work out the brain. Like I said, crossword puzzles, Sudoku, word games, those are all very, very important. If we exercise our body, we also need to exercise our brain. Reducing your stress load, just in general, a healthy lifestyle. Management of relevant medical disorders. So when medical disorders go unmanaged or managed poorly and not properly, medications aren't taken properly, what happens with that is it can cause reversible dementia, like I talked about, and also increase your likelihood of then developing a true dementia. Staying socially connected. This was a huge impact that we saw with COVID-19. With COVID-19, the onset of the pandemic, we weren't staying connected with each other. We weren't able to talk to each other. No one was going outside, really. Everything was up in the air. And through that, the statistics rose with the pandemic. The people who are developing dementia, that number rose greatly because people weren't staying connected. They weren't healthy nutrition, lots of oily fish, blueberries, things that are rich in color, rich in greens. And protecting your head, like we said, one of the risk factors is brain injury. So it's important to, wear a helmet. When, your stability is decreased, it's important to watch yourself when you're walking and try to prevent any falling. So I'm going to briefly go over some warning signs of dementia. These are warning signs. Just because somebody might be exhibiting some of these things doesn't mean they have dementia. It's important that if you notice any of these warning signs, to go see your family doctor, and they'll start that process for you. Changes in mood and behavior. We all have days where we don't feel like ourselves or aren't acting like ourselves. The good rule of thumb for all of these things is if these things are going unnoticed by the person, that could be a sign. If these things are affecting your day-to-day life, if they're affecting your day-to-day conversations, day-to-day living, it's becoming harder and harder to live and perform your daily duties, that's when there should be a warning, a sign that these might be affected. Problems with language. Somebody might be having troubles with finding words, which is a normal part of aging, but when it's significant and impacting every day-to-day conversations, then that's when something we might need to take as a warning sign. Also, mixing up the words for things, using, the wrong word for cheese or the wrong word for chair and things like that. Problems with abstract thinking. They might have troubles reading signs or symbols. Difficulty performing daily tasks. This is a huge one. This is, if you take one of these away, this is the one to take away. Daily tasks, meaning getting dressed, making the same meal you've made, making a pot of coffee. If those are all of a sudden becoming difficult or forgetting steps for those, then that might be a warning sign. Misplacing things. Misplacing things is common. I misplace a lot of things, especially like my car keys and my telephone. But when you're misplacing things and finding them in odd spots, when you're finding your car keys in the fridge, or you're not even noticing that these things were misplaced in the first place, then that might be a warning sign. Loss of initiative. This is often where, when I talked about those reversible dementias, depression was the first one on that list. Loss of initiative is, as a warning sign, is often mistaken for depression, and the diagnosis of dementia gets prolonged because it's often seen as depression. What happens is our start button in our brain that initiates us to get up and do a task and perform on the thought that we're having to get up out of our chair, out of our bed, that is damaged. The dementia will cause damage to that part of the brain. Disorientation of time and space, whether that be not knowing where they are in that moment or not knowing where they are in time. They might be reliving things in their childhood or in their teenage years or when they were still working. Memory problems that disrupt daily life. Our memory diminishes as we get older, and that's normal. But what's not normal is, well, like I said, when it's impacting your daily life, when you're not remembering that you already asked a question. Like a common one is somebody asking the day of the week, very common, or what the date is. The brain doesn't register that was already a memory and that memory was made. So that question keeps getting asked again and again, or that memory, calling the doctor's office to make an appointment or things like that. Changes in personality, these things need to be significant. There's days where we have changes in our personality, we don't feel like ourselves, but these are going to be significant changes. So the person has been an introvert their whole life and they're all of a sudden extroverted, or the extrovert is all of a sudden very, very withdrawn and introverted. They're going to be huge changes in personality. At first, they might be subtle, but by the end, if it goes undiagnosed, then they will become huge changes of personality. Impaired judgment. This is common in the wintertime. Somebody living with dementia might be seen going onto public transit in a nightgown, or when it's hot outside and have 5 sweaters on. Somebody might not have a filter and make inappropriate jokes and so on. So that's kind of covering my topic about dementia. I'm going to briefly talk about who we are at the Alzheimer Society. So we are a nonprofit corporation. We are governed by a board of volunteers. The Alzheimer Society is supported by individual and community donations, special events, fundraising, and also receiving funds from Ontario Health. So we just had our walk for Alzheimer's, and all of those donations, all the amount that people donated and got pledges for, it all goes to our clients, and it stays local here at the Alzheimer Society of Thunder Bay. The Alzheimer Society of Thunder Bay is affiliated with the Alzheimer Society of Ontario and the Alzheimer Society of Canada. It's all across Canada, it's all across Ontario. We in Thunder Bay are for our community here. So we provide support services for people living with dementia and their care partners living in the community. We provide education such as today and fundraising to help us support our clients and give those services to our clients. So some of our services include education for care partners, education series for care partners of people living with dementia. We provide one-on-one counseling. We also have support groups as well for a variety of topics, variety of recreation programs for our clients as well. We also have a variety of brochures and different information resources available to the public. If you ever have any questions, you can always give us a call. This is our phone number on the screen, and I would like to thank you all for your time today.